Hello everyone. So it's the 31st of August 2019 and we're a day late with everything, so it's actually day 3 of treatment of chemo. It's day 4 of being in here. It's 10 to 7 in the morning, and I quite honestly say, if I didn't have to be in here, I'll tell you what. See, before I was aware I had cancer, I felt fine. I was completely fine in myself. Now I'm going through chemo. I feel shit. My hair hasn't started to fall out yet, but that's fine if it does. Oh mate. So what happened yesterday is I had half hour on the drip with cyclophosphamide or something similar to that name. And I had to have no, not even that, something else. It was just basically an injection. Mouth's a bit dry. An injection that went into my back, into my spine. And that hurt to put the needle into my spine. It had to go through bone. And today, every time I move, it is like being stabbed in the back. Now, bearing in mind, I had or have got back pain anyway for 2 different reasons. Well, 3 if you count the videos that I've made before. I've got the bone marrow test still healing, which is really painful. I've got the new one which happened yesterday in my spine. I've got sciatica, which is a bit lower than the spinal tap. And I've got lower back pain anyway in the general area from when I was 16, when I wasn't given any manual handling training. So I'm messed up. Kieran Gallagher, good morning. Ross McGarry, good morning. How you doing? Hope we're doing well for you, pal. Hope everything continues to go well. Thank you very much. I don't know if it's going well, to be honest with you. I really don't know. Apparently, if the chemo makes me feel like this, then it's doing its job, isn't it? It's working. So you may be wondering why I've got flowery pillows and bedclothes. The reason why I have bedclothes this colour is because it's to prevent them being taken away. If they're white, they'll be taken away by the staff. It's just to show they're mine. I have got a friend though. Let me see if I can do this. I've got Drippy. He's my watchful friend. He's on the drip pole. He's my mate, look, Drippy. Look, Gucci, 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 Gucci. It's my chemo buddy. Look, Gucci, 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 Gucci. I think he likes it. It's my chemo buddy, Drippy. So, I'm not feeling great today. I've woke up feeling sick. And I've woke up in pain. I've had anti-sickness, I've had painkillers. Hopefully they start to kick in soon. I don't want to be sick again, although it's probably going to happen at some point. Pain, however, the pain in my back is something I'm going to have to learn to live with, because this pain is so deep it's not going to go away for a while. And I'm going to have another one, another injection in my spine on Monday. So just as this may be even clearing up or starting to feel better, they're going to do it again. And I don't think they're going to do it in the exact same spot, because that would be cruel beyond belief. No, they'll probably do it on the other side of my spine, just on the right hand side. It's probably where it will go, as a guess anyway. I don't know. I'm not a doctor. But my mouth is drier than a nun's cunt. Just one thing I'm not looking forward to is apparently cancer patients that receive chemo are prone to mouth ulcers and mouth sores. Luckily, I've not had any of those yet, because it's difficult to clear up. It's difficult to clear up a mouth ulcer because you have no immune system. Those antibodies that fight the bacteria, that fight the virus inside your mouth, they disappear. So I've got no mouth ulcers. I've got no sore mouth, just a really dry mouth. Like that, you know. So I've got a very soft toothbrush. I'm not normally the sort of person that, when I brush my teeth, I like a good firm toothbrush to get in there, you know. I've got a really soft toothbrush just to make sure my gums don't bleed. And it doesn't feel like my teeth are getting clean. I have to rinse my mouth out 4 times a day with strong mouthwash. I've got Listerine. I've also got a prescribed mouthwash to use after the Listerine's done. I've got to do that 4 times a day. And I've got this really weird pipette stuff to go in my mouth 4 times a day, like an antifungal thing. I have to put it in my mouth, swish it around my mouth, and then I have to swallow it down. It's like an antifungal antibiotic. I thought, you cheeky bastard. Antifungal? Do I look like I'm fungified? Fungi. But no, and on a serious note, I'm in a lot of pain this morning. I woke up when I moved in bed and the pain just shot. It shot in all directions out from my back. You know, so if you was to get your pelvis and go like 1, 2, 3, I'm assuming 3 vertebrae up and just to the left. In fact, I'll show you. I'll show you one sec. You fucker. Right, I'm up. Right, let me put my phone down here somewhere. Right. Wait there, you turn the light on, one sec. Right. So, excuse my ass. Just there, that little spot just there, is where I had the bone marrow. Okay, and that went straight into my pelvis, and they twisted like that and pulled it out. And just there is where they went into my spine yesterday, and I've got to have another one of those. I've got to have another one of those on Monday. And the reason why I've got to have those spinal injections is because I need to have chemo in a syringe go into my spinal column to go up my spinal column into my brain to protect my brain, because the cancer that I've got can travel to the brain if we're not careful. So it's a preventative. It's to get up there and stop it from getting up there. That's how that works. So, oh God, my mouth is so dry. I need some water. But no, I've got I've got one. Let me have a look on the time schedules. This is my medication schedule. It tells me how long I'm going to be here on the cycle and whatnot. So I've got cyclophosphamide, 200 ml sodium chloride. It takes 30 minutes. So what will happen with that is they'll flush my PICC line through, which is that thing connected to the inside of my arm, goes up into my chest, just above my heart. And what I'll do is I'll flush it through with saline, right, to make sure that it's clear. Okay. Now attach a drip of saline up here somewhere, and that'll just keep it open. Okay, while they're sorting out the chemo. The chemo bag will go on. It's a 250 ml bag, and it'll go from here into this machine here, into here. Goes in the front bit here, because this bit opens up, and it comes out the side here. And from here it attaches to one of these, and this machine here regulates the flow of the drug that's coming from the drip. So that's how that works. There's two of them now, although I've not been connected to two at a time before. I was always under the impression when you have a drip, it goes straight from the bag, straight to the body, but it has to be regulated. Because if you was to give a chemical too fast, you can have an adverse reaction to it. Whereas the machine thing, the pumping, can restrict the flow, regulate the flow. They can monitor you a lot easier. God, I feel sick. I'm not sure what I want to do. If I sit in the chair, it'll be sod's law that one of the nurses are going to come in through that door. I want to take my observations, which means I've then got to try and stand up like a raspberry ripple, come all the way around here, sit there and have my blood pressure taken and everything else. And then I'm going to have to stand up again looking a bit like Joey Deacon. And for those of you that get offended by that, I really don't give a shit. Have a sense of humour. If you get offended by it, you're a snowflake. And then come all the way back round here and sit there